Hello everybody. We continue the discussion by talking about personal protective equipment. In the era of COVID-19, which has been widespread in the world, one of the biggest problems that has come with COVID-19 is the availability of PPEs. Everybody is asking, I need PPEs, I need PPEs. So this discussion would go on to describe the types of PPEs we have and move on to other sections in this model that will talk about the appropriate use of the PPEs, moving on to the reuse of PPEs and general principles around the use of PPEs. We'll start by talking about the elements of standard precautions. We already know that hand washing is a major part. Very good hand washing, respiratory etiquette, PPEs used according to the risk or according to the activity that you are doing, safety ways of discarding sharps, injury preventions, safe handling, cleaning and disinfections of patient care equipment, environmental cleaning, safe handling and cleaning of soiled linen, and waste management. All of this are standard precautions that would help prevent the transfer of any disease, including COVID-19. So I need PPE. What PPE do you actually need? We're going to talk about PPEs, but first we'll look at the hierarchy of control of a risk. Yes, COVID-19 is now the risk that we have. And in the hierarchy of control, PPE is actually the smallest with the least effective method, with the most effective being elimination. Unfortunately, COVID-19 is transferred by people, so elimination is not an option, substitution is not an option. The first option we would have would be engineering controls, where we can put in measures to try and bridge the gap between an infected person and an uninfected person. The other control can be administrative controls, protocols put in place to protect health workers or to protect patients from other patients or the environment from patients. Then the last being the use of PPEs. PPEs are special clothing designed to protect healthcare workers from exposure to or contact with infectious agents. Depending on the type of PPE used at your facilities, the PPE might be disposable or reusable. So to know your PPEs, we are going to go through them one after the other. Simple PPEs are your gloves. Gloves are simple PPEs that have been used over the years. This is supposed to be a barrier between you and whatever surfaces you are touching. The essence of gloves is to protect you from picking up any infections. Gloves are not fully protective, as it has to be removed whenever they become soiled and changed several times, and that is only when gloves will be effective. Then we go to our respirators, which have become topical in COVID-19. Our respirators are of many different types. We have the N95 respirators or the FFP2 or 3 respirators. There's also a modification of respirators, either having a valve or not having a valve, and this will be discussed further in the discussion. With our waterproof gowns, you can have the simple waterproof gown that can be worn based on the activity that you are doing, or the full coverall, which covers the entire body based on the activity that you are doing related to a suspected or confirmed COVID-19 patient. The common mask that we have, known as a surgical or medical mask, is what is going around and can be used in areas where you're not suspecting aerosol generating procedures. Then we have our face protection or our eye protection. So either you have the goggles or you have the face shield, which should be used in case you're having a patient that can have splashes towards your body. So the next point we are going to go to is to discuss how to wear or remove your PPEs. We've been able to establish the type of PPEs that we have. Now, do we wear them correctly or do we remove them correctly? It is during this period that there's a higher risk of being infected with a disease if the process of wearing or removing is not done correctly. So which PPE is needed for which event? First, before you move to a patient's side, you would have to start considering what activities are you going to do. Decide on the activities that you are going to do, the processes that they would go through. Is there a risk of being contaminated with blood, body fluids, respiratory droplets? Is there an open skin that would help make infection transfer much easier? So you select the PPE that you are going to wear based on this assessment. Remember to perform hand hygiene continuously even during that process, and this should be done for each patient and every time. Make this your routine. So how to wear your PPEs? In the additional reference videos, we will provide a link that shows a video of someone wearing the PPE and taking it off. But these are a few points. Remember, hand hygiene is always essential. Perform your hand hygiene for 20 to 30 seconds with water, running water, and soap. You first put on your gown. The gown goes on first, followed by your mask, and then your face shield, and then you put on your gloves. It's advised to use elbow gloves as it helps increase the level of protection. And this will be you in a full PPE, ready to enter a place with COVID-19 patients with the risk of aerosol generation. When you are done seeing the patients in this area, remember that in between patients, you would have to change your gloves and do hand hygiene. But when you're stepping out of the isolation area or the treatment area, when you step out, your top glove is considered dirty. You remove your top glove, you remove your gown, then you remove your face protection, and before you remove your mask. If there's a chlorine bath and you had shoe covers which had been removed along with your gown, you step in the chlorine bath to decontaminate the shoes that you are wearing. Or if you are wearing boots, you use a boot cover, a boot remover to remove your boots. In between each step, kindly ensure to perform hand hygiene in between each step. As you've worn all your PPEs and you're about to wear your face mask, you're supposed to ensure that the face mask fits properly. These are the few steps you need to go through to ensure the face mask is correctly. Place the mask into your hand, ensuring that both straps are hanging loosely under your hand, with the top part closer to your fingers. Place the mask over your nose, covering your nose and your mouth. Lift the strap, the top strap, over your head, resting it at the back of your head, as demonstrated. Lift the lower strap over up to the base of your neck. When this is done, adjust the metal piece on top, making sure that there's a tight fit. So as described earlier, there are two types of face masks, one with a valve and one without a valve. For the one with a valve, you do a negative seal check. So after you have worn your mask, ensuring that the straps are in the correct places, you would want to do a negative seal check for ones that have a valve. This is the valve. So for the ones that have a valve, it allows you to breathe out air through the valve, but nothing comes in. In order to do the negative seal check, you exhale deeply. And if the mask is well fitted, it should cling to your face. Let me demonstrate this. You could have seen the mask filling my face, making sure, if this is not how it felt, you adjust the metal straps, ensuring that the metal straps are well fitted, and then you try the test again. Feeling that the mask closes in and feels to cling to your face. If this is how it felt, it means that your mask is well fitted. So for the second type of mask, this is the mask without a valve. If you look in front of this mask, there's no valve in front of this mask. So when you have worn the mask as instructed, having the straps well in place, you'd want to do the positive seal check. So for this, you'd want to blow out forceful air to find out if there are any leakages. You can feel the leakages above your nose, around your nasal bridge, or sometimes around your mouth. If there's any leakage, you'd want to go back and repeat this. So this is done in this manner. As I did this, I did not feel any air around this. If you did, readjust the metal straps and then try the test again. Repeat this step until you know that the respirator has a good seal. Standard precautions for your PPEs, and these are the general rules when you are wearing your PPE. Always perform hand hygiene before and after use of PPE. Remember to perform hand hygiene in between each step whilst you are wearing or removing your PPE, especially when you are removing your PPE. Before putting on a PPE, inspect it thoroughly. Make sure that there are no tear marks on them, there's no part of it that is damaged before you do it. Remember to do a risk assessment or a task assessment to decide which appropriate PPE you need for which kind of patients. Always put on the appropriate PPE before you come into contact with patients. Immediately after contact with patients, remove the PPE, dispose of it in the waste bin. If it is a reusable PPE, put it in the appropriate container and allow for it to be picked up and carefully decontaminated and ready for reuse. Disposed PPEs should not be reused. If it is a non-reusable PPE, kindly do not reuse the PPE. Standard precautions for PPE also states that once a PPE is on, you should perform all the patient's activities that you have commenced. Do not adjust or touch the PPE, especially touching any part of your face whilst in the PPE in the patient's room. A lot of healthcare workers' infections occur whilst they try and adjust their PPEs whilst in the patient's room or during the doffing process, and this should be taken carefully. Kindly pay attention to the link with the video for the donning and doffing procedure. This image shows you all the wrong ways you can wear a mask: leaving your nose open, having a space under, wearing the mask on your chin, touching the surface of your mask, having the mask hanging off your ear or on your forehead, using your mobile phone while touching a mask. And this image is courtesy the Ghana Association of Doctors in Residency. So we would like to summarize some of the use of PPEs. The first point we would like to make is that try and minimize the use of the PPE. If you can minimize the use of PPE entirely by reducing your contact to the patient, that gives you a lot more protection. Remember, the engineering controls are much higher than the use of PPEs. Physical barriers to reduce the exposure with patients and then restrict healthcare workers from entering places in rooms with COVID-19 if they are not involved with direct care. Cloth mask has become very popular, and in Ghana, the use of masks is now mandatory. You cannot leave your house without a mask on. There have to be a little tricks of how to wear your face mask. Here are a few pointers. Put your mask over your mouth and your nose. Tie it or have it strapped at your earlobes and let it fit well and not just hang over your mouth. Do not touch your mask whilst you're wearing it. If you accidentally touch your mouth, wash or sanitize your hand immediately. Remove your mask carefully and make it ready to be washed in warm water and rinse it, hang it outside, and make sure that it is clean and ready for the next time you have to use it. The last thing we're going to talk about are general principles that would help protect you with COVID-19. Remember, we mentioned that there is a hierarchy of control: elimination, substitution, engineering control, administrative controls, and PPE use. Elimination and substitution are not possible as the transmission is via human beings, and thus we can only start from engineering and administrative controls. We mentioned the use of barriers as engineering controls, and then the full design of isolation areas and treatment areas to help reduce the risk of infection. But you should realize that administrative controls also play a big role, and some of the administrative controls is illustrated in the diagram that we are showing here. If a patient comes to the hospital, ensure that there is 1 meter between the patient and the one that is doing the screening. Perform your screening tool. If the patient is negative for your screening tool checklist, the patient can now proceed to either the consulting room, ensuring that they are sitting 1 meter apart from each other. If the patient has respiratory symptoms or a cough, they should wear a mask, or now generally all patients should be in a mask. If the patient is severely ill and is being seen in the emergency, they should wear a mask, and the doctor seeing the patient should be in the appropriate PPEs, either at the OPD or at the emergency. If the screening tool marks the patient as being suspected of COVID-19, the patient is moved to an isolation area, and then the patient is seen there. Sample should be taken for PCR for COVID-19, as is the common sampling method that is being used in Ghana, and also patient is isolated until the test results are ready. The health workers going to this area should therefore ensure that they are in the appropriate PPE, coveralls, N95, as there might be aerosol generating procedures, which include a sample taking, and make sure that they doff their PPEs correctly when they are coming out. We are going to run out of PPEs, and as we start to run out of PPEs, the general principles is to ensure that the engineering controls are being followed, adhering to barriers, administrative controls such as altering the work methods, altering the shifts for health staff, cancel elective or non-urgent procedures or appointments, or rebook them in institutions that have less load and can handle these effectively. Reserve the PPEs for health workers who are going to be in contact with patients, and control the use of PPEs so that they are not misused in the facility. Ensure reusable PPEs can be reprocessed and used in this sense. And consider that all health workers that are coming in touch with such patients need to be well trained in order to avoid themselves being infected with this. If we talk about the health workers being exposed, the risk assessment and management of exposed health workers, as recommended by WHO, is summarized in the image as we can see. If the patient comes into contact with a COVID-19 patient, that's a face-to-face contact within 1 meter of a confirmed case, or in the presence of an aerosol-generating procedure, or coming into the environment of the patient, that is the bed, the kneeling, or any of the medical equipment being used, including the bathrooms, the health worker is considered exposed. This does not mean that you will get COVID-19. You go through it and find out that after you've been exposed, did you go along the basic principles? So if you were in the appropriate PPEs all the time, you are considered to be low risk, and with this, you can return to work, monitor your vitals, and report to your superior if there are any temperature changes or any symptoms that you start to develop. You will be considered high risk if you do not follow the procedures of infection prevention control. If you didn't wear your PPEs the appropriate way, if you didn't perform hand hygiene the appropriate way, or if at any point there was an accident where there was body fluid splashing on you, making you a high risk. High risk are supposed to isolate, be tested for COVID-19, and when the test results are negative, they can still remain in isolation and retested, or using the new principles based on the duration of symptoms, or if they are asymptomatic, they can then be discharged from their isolation. We all will be going home as health workers or anybody involved with COVID-19 patients. We need to keep our loved ones safe. So before you finish your shift, ensure that you have washed your hands thoroughly, probably your hands and your forearm. If possible, remove your uniform and change into different clothes before you leave. Give the uniform to the laundry for it to be washed, if this is available. If not, put your uniform in a plastic bag, disinfect your phone before you leave. When you arrive at home, wash your hands immediately, put your washings in the laundry basket and wash it separately from other clothes. Iron it thoroughly before you wear it again. The rubber bag in which you brought your dirty clothes from the hospital in should be discarded. Remember to wipe your phone, your car keys before you move to the rest of your family. Thank you very much for your support. Thank you very much for your attention. And also, remember that part of these slides were taken from WHO Infection Prevention Control for novel COVID-19. Thank you for your attention. In summary, we discussed the type of PPEs that we had, looking at the various types of PPEs and which of them is appropriate for which event. We also talked about the wearing of PPEs, which is the donning, and taking of the PPEs, which is the doffing. And the videos in the references would help you to rewatch and get very acquainted with the donning and doffing of the PPE. We also talked about the general principles, the screening, how to have a flow for your patients, the engineering principles that would help protect you, and the administrative principles that will help protect you. We concluded by teaching you how to keep your family safe in these trying times. Thank you very much for your attention.